Hello friends, my name is Dr.Muskan Chhabra and I'm working as consultant IVF at Birla Fertility IVF, Lajpat Nagar, New Delhi. Today we are going to talk about egg freezing. So all women want to be mothers someday, but right now may not be the right time for you. Egg freezing in today's day and age provides you the opportunity to become a mother when you are ready. Maybe you have not found the right partner. Maybe you are career driven and you want to focus on career at present. Or there can be medical indications for egg freezing such as chemotherapy or in transgender individuals before gender affirmation surgery, or in case of simply biological clock which is ticking. With the onset of delayed marriages in society nowadays, it is more and more important that we freeze our eggs at the right time in case we are delaying marriage. So how does egg freezing help us? We have to understand that fertility in women declines rapidly after the age of 37, and our ovarian reserve is something that will keep on declining as we age. So the quality and the quantity of our eggs will decline rapidly as we age and proceed towards menopause. In case we are delaying childbearing and fertility, it is always beneficial that we should consider freezing our eggs, and this freezing should be done as early as possible because age is one of the most important factors which decides fertility. Let's talk about what happens when we decide to freeze our eggs. When we decide to freeze our eggs, you will undergo a battery of investigations and some ultrasounds. The basic reason why we do the investigations and the ultrasound is to understand how healthy you are at the moment. Also, we also want to see whether your hormones are in sync, and we do a scan to see whether everything is baseline and normal with your body. In cases where we are doing fertility preservation for cancers, you may have to undergo these investigations in an urgent manner, and we may have to start your cycle immediately as soon as you receive your diagnosis. Once the decision for undergoing egg freezing is done, we give you some hormonal injections, the purpose of which is to grow your eggs. Multiple eggs will grow in both the ovaries and reach a size of 18 to 20 millimeter when a trigger injection is given, and then you are called for the oocyte retrieval procedure, under which we give you general anesthesia and retrieve the oocytes vaginally with the help of a thin small needle. These eggs are then taken into the lab and they are processed. After processing, we freeze these eggs in liquid nitrogen, and then these can be kept frozen for many years. So how many years you can keep these eggs frozen? You can keep these eggs frozen for upwards of 10 years, and usually when you are ready to use them, what happens when you're ready to use them is that when you come to us and you decide to go ahead with the treatment, at that time, with the help of the sperm of your partner, these eggs are thawed and ICSI is done, in which one sperm is injected inside one egg and babies are made, and these embryos are used for embryo transfer. The advantage of egg freezing is that these eggs are frozen at the same age at which they were retrieved. So they have a lesser chances of genetic abnormalities, and you have a better chance of achieving a pregnancy with these eggs, even if you are of advanced stage later on, or if you have undergone a medical procedure and at that time you cannot undergo IVF process. So once you are ready for the IVF process, both mentally, physically and socially, then you can go ahead and have children and realize your dream of motherhood. Thank you so much for a patient hearing. If you have any doubts or questions, you can always message in the comment box below and we'll get back to you. Thank you so much.
Book a free consultation today.